Hi, this is Dr. Greg Relo with Express Dentist. Sometimes patients need to have a tooth removed for various reasons. Maybe it's an abscess tooth, maybe it's a tooth that's lost bone, maybe the tooth has cracked or split in a way that there really is no other choice. So when that tooth comes out, we have a area in the bone that is a fairly good sized hole. When you look at a tooth, you only see like the top 1/3 of the tooth. The other 2/3 is encompassed in the bone. So when that tooth comes out, there's a fairly large hole there, especially with the molars where you have multiple roots. Upper molars can easily have 3 roots on them, and the lower molars can have 2 or 3, 4 in some cases. Either way, there's a lot of space that is left when a tooth comes out. Now, when the blood clots in that area, there are certain factors in the blood that come in and start to repair. It's a slow process after the clotting takes place, but eventually the bone starts to fill in and new bone is generated. But because of that space that's there can be shrinkage of the bone. The walls that are around that hole can start to suck in a sense, and really start to collapse. And if you're thinking that down the road you may want to have that tooth replaced, especially with a dental implant, we want to have a nice volume of bone there to place that implant into and have it be successful over the long haul. So if the bone shrinks in, you could end up with a situation where it's just too narrow of a space. We've lost too much bone, it's shrunk down, and in order to place an implant, you have to go through some extensive grafting in order to regenerate that bone or to replace it. And so one of the options you have is if you're thinking that you may want to replace a tooth in the future, even if it's a slight possibility, one of the things you can do is have some grafting material placed into the hole right at the time when the tooth is taken out. So the tooth comes out, the area is clean, there's nice healthy blood flow, and then the dentist goes ahead and places some ground bone. In most cases, there are different products, but in one example, it would be cadaver bone. This is cadaver bone that is treated and approved for this type of placement, and it provides the matrix or the framework for new bone to generate. So that bone is mixed with your blood, it's pushed down into the site firmly, and now you have this really nice framework for your own bone to fill in and grow. And we see a lot less shrinkage in that case, and the fullness of the bone remains. And then as it fills in and mineralizes over the following months, you then have bone that's very close to normal. In some cases, it's even denser, depending what's used and on your own body. But basically, this then gives you less risk if you are to place an implant in the future. There's much more support. This can also be good just for the teeth on either sides, to have that bone that doesn't shrink down or pull away on the side. So certainly grafting at the time of tooth extraction is something to talk about with your dentist and see if it makes sense for you to do it, because it's relatively simple to do, and in the long run maybe less expensive than some of the other complications that can occur. So Express Dentist, we have a trusted network of dentists that can help you. If you give us a call, if you're looking for a dentist, if you think you need an extraction, you want to talk about your options, give us a call and we can help set you up with someone in your area so you have the best outcome.